Okay, welcome to part 4 of femur and pelvic girdle anatomy. I wanted to begin by taking a look at this projection. This is something you'll commonly see at clinicals. This is the axiolateral projection, and it's actually a lateral view of the proximal femur. This is also known as the Donnellus Miller or the cross table hip. So it goes by a couple different names, and certainly we'll learn this projection in lab, but it's kind of hard to look at the first time you see it. So I wanted to point out some of the pertinent anatomy here. A is pointing to the acetabulum. So just kind of orientate yourself here. B is the femoral head, and C is the femoral neck. D then would be the body of the femur. E is the area of the lesser trochanter. It's really not very visible on this projection, but F is the greater trochanter. You can see that here. And then G is the ischial tuberosity, again found on the ischium. So again, I know you're seeing these at clinicals, and I kind of just want you to orientate yourself so you can start picking out anatomy. If you look at the next slide here, this is also the axiolateral, but it kind of gives us a vantage point of where the central ray is coming, where the IR is placed, okay? So the affected leg is left down, the unaffected leg is raised, and then the tube is angled towards the femoral neck of the affected side. The image receptor is placed next to the leg. The top of the image receptor is approximately the level of iliac crest. But again, I'll demonstrate this in lab. Let's just look at the anatomy here one more time. So again, A is acetabulum, B is femoral head, C is femoral neck, D is the body of the femur, E is lesser trochanter. Remember, not very visible on this projection, but the area of the lesser trochanter. F is greater trochanter, and then G, of course, is ischial tuberosity. Okay. Good. I want to finish part 4 by talking about the joints of the pelvis, including their structural and functional classifications. So let's begin by reviewing the joints in question. So this slice, or this image rather, is a coronal slice taken through the pelvis. So we've made a coronal slice and removed the anterior part of the pelvis. So notice first the sacroiliac joints, or the SI joints. They are formed by the joining of the sacrum and the ilium of the pelvis. Okay, and the SI joints are kind of highlighted here in this gray color. The pubic symphysis is the joint between the right and left pubic bones, specifically the superior rami of the pubic bone. And then the acetabulum. Remember, that's a temporary joint between the 3 hip bones, the ilium, the ischium, and the pubis. And remember, that fuses in our mid-teens. And then, of course, there's the actual hip joint between the head of the femur and the acetabulum. So we're going to discuss those in more detail next. I really want you to pay attention to the structural classification and the functional classification of each of these joints. Okay, so let's talk about the SI joints first, or the sacroiliac joints. They're a pretty wide, flat joint located on either side of the sacrum, in between the sacrum and the ilium. And if we go back to the previous slide, you can see that in anatomical position, they're actually oblique joints. Okay, so if the joints are situated obliquely in the body, it makes sense we're going to have to oblique the patient to place that joint perpendicular to the image receptor. So we'll talk more about that in lab, of course, but I kind of want you to have that in your mind. The SI joints are synovial, so that is their structural classification. And remember, that means they're enclosed in a fibrous capsule that contains synovial fluid. Remember, most synovial joints are freely movable or diarthroidal, but the SI joints are considered a special type of joint and are actually classified as amphiarthroidal, which permits little movement. So they're synovial and amphiarthroidal. And remember, amphiarthroidal then is their functional classification. The SI joints are very snugly fitting joints between the sacrum and the ilium, and they actually bear a lot of the body's weight, and as a result, they're not very mobile or movable. And actually, as we age, this joint is reduced in size and can become even non-existent in our male patients. Okay, good. So next joint then is the pubic symphysis. We know that that's the articulation between the right and left pubic bones. It's located in the anterior pelvis, and it's very midline. Remember, the pubic symphysis is actually palpable. Typically we don't, of course, because it can be embarrassing for our patients. But remember, pubic symphysis should be included on all of your supine abdominal radiographs. Okay, remember the level of the pubic symphysis is the same level as the greater trochanter and the femoral neck. Okay, the pubic symphysis is cartilaginous, so that's its structural classification, and it only allows limited movement, so it is amphiarthroidal, again, which is its functional classification. The two bony surfaces of the pubic symphysis joint are separated by a fibrocartilaginous disc, and the bones are actually held together by ligaments. Now, this disc of fibrocartilage is relatively thick, and it's thicker actually in females, and that pad of fibrocartilage is capable of being compressed or even partially displaced, which allows that limited movement that we want during childbirth or even in the case of pelvic trauma. Okay, next let's talk about the acetabulum. Remember, the three hip bones, the ilium, ischium, and pubis, are separate bones in children, but they come together and fuse in the acetabulum during our middle teens. The acetabulum is classified as a cartilaginous joint and synarthroidal or immovable. And if you can picture the acetabulum and how the three bones fuse together, you can imagine that there's no movement happening in that joint. The acetabulum is actually considered a temporary growth joint, similar to the epiphysis and the diaphysis of long bones in growing children. So it's a temporary joint, and then in our mid-teens, they fuse together into one solid piece of bone. Last joint I want to discuss then is the hip joint. The hip joint is classified as synovial and diarthroidal or freely movable. The hip joint is classified as a ball and socket or spheroidal joint because the sphere-shaped femoral head sits in that rather deep acetabulum. The hip joint is inherently strong as it supports the weight of the body while still allowing for a high degree of mobility. A series of very strong bands of ligaments actually surround the articular capsule and the joint, making it a very strong and stable joint. Think about the shoulder joint. It's also spheroidal, but it's much less stable and strong, and therefore we see a lot more shoulder dislocations than we do hip dislocations. Lastly, movements of the hip joint include flexion and extension, abduction and adduction, medial and lateral rotation, and circumduction. Now, there's a summary of all of these joint classifications in your textbook, so you can certainly review it there. But I do want you to be familiar with the structural and functional classifications of these four joints. Okay? All right, that concludes our recorded lectures. If you have any questions about pelvic girdle anatomy, please let me know. Thank you.